When one thinks of healthcare, sexual health and wellness may not top your charts. However, it's a realm of health that should not be discredited. And organizations like Planned Parenthood provide the resources necessary to maintain this health. I myself have utilized these resources as I have been STI tested through Planned Parenthood, and I've also volunteered with them in the Dallas and Fort Worth area at some of their offices. And from this interaction and from that experience, I've been able to see the overall individual and communal benefits that they can provide. One thing though that is important to note is when I got my test done, I have an insurance program, I have an insurance that covers those tests, and I did not have to pay anything out of pocket. But for many others, that is not the case. Therefore, I believe that all working men and women should have access to Planned Parenthood and their services regardless of their income and regardless of their occupation. And further, I believe that these should be funded by the federal state. So within this presentation, we're going to be going over some of the communal disparities with sexual health within our communities and our workplaces. We're going to look at the implementation of a universal healthcare system, and we're going to look at the benefits of universal healthcare, including Planned Parenthood services, and finally, we're going to look at some of the costs that do come along with implementing such a system. So to begin, let's take a look at some of those disparities. Now, it is important to understand that some of these disparities have come because of the clash between Planned Parenthood and certain establishments, and one of these establishments that is most notable is Hobby Lobby. So Churchill, within his article published in 2015 titled "Whose Religion Matters in Corporate RFRA Claims After the Burwell versus Hobby Lobby Stores," kind of highlights the case in itself, Burwell versus Hobby Lobby, and notes that Hobby Lobby is a religious organization, namely they're a Christian. Because of that, they do not believe in some of the contraceptive provisions that Planned Parenthood does provide to its patients. And because of that case, the Supreme Court did rule that Hobby Lobby is technically a person. Corporations are people. And because of that, they are either able to accept or deny the providing of these services to their employees. Now, when these employees are left out, you're going to be seeing a lot of people being excluded because they cannot compensate for this on their own means. The out-of-pocket expenses can be an extreme deterrent for those who are within low-income situations. And Gold and Sonfeld in 1999, in their article, Family Planning Funding Through 4 Federal State Programs, found that with this deterrent from the out-of-pocket expenses, people are going to avoid this care altogether. And further, the accommodations that Planned Parenthood does provide sometimes do not overcompensate or do not compensate for these deterrences. So we must understand that these opinions and rights must be observed, and therefore the solution must come from outside of Planned Parenthood and the individual, and the answer is with a universal system. Now, when you implement a universal healthcare system, one of the first things you're going to see is that it increases the availability of healthcare to low-income individuals. Mutumba and his colleagues in 2018, within their article titled "Community Influences on Modern Contraceptive Use Among Young Women in Low-Income Countries," found that when you implement these federally funded services, people within those low income and low socioeconomic status situations are going to take advantage of it, and they're going to get the care they need immediately. In addition, Galvani and his colleagues in 2020, in their article titled "Improving Prognosis of Healthcare in the United States," they found that citizens and corporations both spend less on healthcare when you have a universal plan put in place. In ties to religious organizations, you're no longer going to be seeing any sort of moral complications. Churchill, in his article, as stated previously in 2015, noted that no person would be paying directly for Planned Parenthood, therefore you're not going to be finding the clash between their own personal religion and Planned Parenthood. And in addition, May, in her article in 2009 titled "The Cultural and Cholesterol Situation," finds that universal healthcare removes affiliation from these corporations, so the situation like Hobby Lobby would have never happened in the first place. Now, once these are implemented on a national level, we can begin to see these benefits. So, with improved sexual health, you're going to see an improving in community health. So with Fisher and his colleagues in 2011, in their article titled "Results of a Worksite Health Environmental Initiatives," they kind of looked at corporations who boosted the amount of healthcare provisions that they provide to their employees, and found that with this increase in healthcare, you're going to find an increase in productivity in your workers and increased satisfaction of your workers. And then farther, Sundstrom and his colleagues in 2019, in his article titled "The Closer the Better," they found that with responsible sexual interactions, you're going to be helping everybody. And also, these benefits have been seen in other countries who have implemented universal systems. So Yu Zhong and his colleagues in 2015, in their article titled "Meeting Demand for Family Planning Within a Generation," they found that overall community satisfaction increased when this universal system was put in place. And further, with the increase in women's access, it does help everybody. In this case, it was in Vietnam, and namely in Vietnam, sex work is very, very prominent. And so when you have those workers who are able to perform their jobs safely, you have an overall better experience for those workers and their clients. Now, the federal funding of these services may create a healthier community, but it will not be without a cost, which we will touch on right now. So, some obstacles that we will need to overcome are the fact that with implementing a system as expansive as this, you're going to need the overarching support from your community. And as we've been looking at previously, those who are religious may not support this. And so, in Phil Toe's article in 2012 titled "Catholic Charities, Catholic Health, Assessing Challenges with the HHS Mandate," he found that when you have this separation of church and state, or when you force this church and state, you're going to be finding a lot of disruption, because the state represents the constituents that live there. And if they do not agree with what's being put in place, they're not going to be happy. Further, Hutchinson in 2016, in his article titled "Hobby Lobby, Corporate Law, and Unsustainable Liberalism," even pushes further to consider it as religious suppression. If a system like this was put in place, who is to say that those who do not agree with it are being suppressed, whose voices are not being heard, and who are, as he said, were being thrown out the window? Now, we're also going to be seeing some effects on the taxpayer. If you're implementing a universal system, it is going to require a lot more funding from the citizens. And within an article written by Maldonado and his colleagues in 2019 titled "Risk Exposure, Humanitarianism, and Willingness to Pay for Universal Healthcare," found that when these healthcare provisions are not what people agree with, they are not going to want to pay for them. And then further, if people aren't going to want to pay for them, this may require redistribution of the federal budget. And if you redistribute it, you're going to be shorthanding some other sorts of programs that could also be beneficial. Now, though the cost may catch the eye, the overall benefit of wellness will equate to these costs. So, to wrap it all up, the necessity is undeniable. The demand can also be met through this federally funded program. And through the single-payer system, sexual health will be maintained without compromising the morals of persons. And though there may be a small financial burden, the benefits will outweigh the costs in the long run, and the overall wellness will compensate. So therefore, I still believe that all working men and women should have access to Planned Parenthood and their services regardless of their occupation or their income, and it should be funded by the federal state. And through our voices and votes as citizens, we can ensure that everybody can receive the sexual health care that they need. And it is time to bring the sexual wellness center stage and treat it as a priority. So I urge you to reach out to your representatives, and for Lincoln and Nebraska in general, reach out to Don Bacon, phone number is here, and reach out to Jeff Fortenberry, whose phone number is right here. Thank you.